Hi, everybody. My name is Greta Mah. I'm the pharmacist and coordinator for North York General, Fanny Bernstein Living Well, Parkinson's. Today, I'm going to talk about the subject medication management for later stages of Parkinson's. So let me share my screen. Okay. So the first question that I always get asked is, will my medication stop working or become less effective over time? So the truth is your medication always works. They will either supply dopamine or keep dopamine in the brain. But after years of Parkinson's, with the disease progression, our brain is not producing enough dopamine and will rely on the external source of dopamine supplement over time. And your doctor need to either increase the dose or give it more frequently. So why does it happen? So as you look at this picture, you see the line across. So this is the line representing the therapeutic dose. So as we take a pill, the drug level will go up above the therapeutic level, and that's when we feel good, the symptoms go away. But our body has different enzymes to deactivate uh, the dopamine or levodopa. And as the drug level goes down, and we notice the symptom comes back. So around this period, then the symptom gradually come back. So we feel stiff muscle, slowness with our movement. So if we don't take our dose around this time and we let this off period longer and the symptom become more severe and disturbing. And that's why we need to take our pills on time. And in fact, everybody's schedule is different. So we will talk about monitoring our symptoms according to the time we take our pill. And then we can see if the schedule is appropriate for you. So as the disease progresses, the duration of benefit will become shorter and shorter as we rely totally on the medication. So sometimes people complain when I take the medication, it takes a long time to work. And usually it takes about half an hour. But if it takes like more than 1 hour, then there's something we need to investigate. Am I taking levodopa on an empty stomach? Because the pill has to travel from the stomach to the small bowel to be absorbed. So if you have a full breakfast, then all the food will delay the pill traveling from the stomach to the small bowel. So it's important to take your pill at least half an hour before or 2 hours after a meal because the stomach needs 2 hours to empty a full meal to ensure the stomach's empty. And the other one is constipation. So if someone have bowel movement after a few days, so there's a lot of buildup. So the colon is not obstructed, but very congested. In that case, the small bowel is also being affected. So we need to have a functional small bowel to absorb levodopa effectively. And the third one, if the pill is not well dissolved, we may consider chewing one of the tablet and take with water, so to allow parts of the dose to work faster. Now, if all these are not sufficient to improve the symptom, some you may consider taking the pill like half an hour earlier. And what else can we do if the symptom recurring frequently? We consider the wearing off is quite disturbing. So it depends on when all these symptoms recurring. So if it happens during the night, you have hard time turning your body or getting up to go to the bathroom, um, discuss it with your doctor. You may take a levodopa control release to help you through the night. or if the symptoms happen before the second dose, and the doctor may increase the first dose by maybe half a tablet or adding entacapone. So this is the medication taken together with levodopa to extend the benefit. Or the other option is to take the second dose earlier. But when you take the second dose earlier, that also means the increasing the gap between the second and third dose. So if the wearing off happen frequently, almost before each dose, and your doctor may end up giving your pills more frequently. Like instead of 3 times a day, may increase to 4 times, or increase from 4 times to 5 times a day, or even adding another medication, which is called resargilin. So resargilin works differently from levodopa. It doesn't add more dopamine to the brain, but it retains dopamine in the brain so that it works very well together with the levodopa. So I mentioned entacapone. So entacapone alone has no benefit. All it does is to allow levodopa in our system longer. So when we have entacapone, it will stop the enzyme breaking down levodopa. So we have more levodopa getting to our bloodstream to the brain. The main side effect is watery diarrhea. That doesn't happen often, but if it does, you should inform your doctor. Some people may not be able to take entacapone because of the severe watery diarrhea. Now, everyone who take entacapone may notice the urine become orange brown, and this is completely harmless. It's just the color from the pill, but it's a good idea not to bite or spit the pill because you don't want the stain, orange stain on your teeth. Now, some people may experience mild jerk or twisting movement in the body, the neck, or the arms. And sometimes when we see Michael J. Fox, when he's having dyskinesia, he has some of these movements. So usually people don't mind as long as they're able to function. And because the dyskinesia is usually temporary, maybe about half an hour or so. But if it's very disturbing or lasts a long time, the doctor may need to adjust the medication. So why does that happen? So dyskinesia tend to occur in someone who's younger and have Parkinson for many years. So imagine the brain having Parkinson's suffer from uh, being deprived from dopamine because our body naturally produce dopamine, uh, releasing it consistently in our bloodstream. But when we have Parkinson's, we rely on the medication because we're so deprived of dopamine. And each time when we take a dose and we have that unnatural, like pulsatile stimulation, so our brain tend to be a little overstimulated and having these movement. So we notice more when the doctor increased the levodopa dose too much or when the individual having significant weight loss. So these movements tend to be more prominent. So inform the doctor, let him know when the dyskinesia occurred the most often, and the doctor may reduce your dose by a little bit or may increase the dosage and add resargilin to even out the level of dopamine in your system. Now, if dyskinesia is very severe, the Canadian treatment guideline recommend using a small dose of amantadine. So this medication is not really suitable for elderly because it can cause confusion and it can also causing urinary retention and constipation. And some people also find leg and ankle swelling and the red skin blotches on the skin. So this medication should be taken during the day because taken during the night can affect sleep. So scientists been trying to investigate the cause for Parkinson's. In the future, we'll be able to have medication that actually delay the progression. But at the moment, we only have treatment to provide dopamine. So now we have better treatment to provide drug at a consistent level instead of having this roller coaster peaks and troughs. So one that we have um, approved in 2023 is the false levodopa, false carbidopa continuous infusion. So this infusion is under the skin. It's almost like insulin pump for diabetic patient. So people can carry the pump, go to work or exercise, and to provide continuous level of dopamine to the system. So people who are currently taking levodopa more than 5 times a day or having a lot of wearing off or troublesome dyskinesia would be a suitable candidate. So the major movement disorder center like Toronto Western or Baycrest, they provide this treatment and is covered by the drug benefit for senior. So the infusion site may cause some skin irritation and other side effects just similar to levodopa. The dizziness with drop of blood pressure may happen, especially people with low blood pressure. So the side effects of hallucination, which is like seeing things that's not real, tend to be much less when using lower dose at night. And the other treatment is using the intestinal gel that is through infusion with a small tube directly to the small bowel. So patient will have this gel infused over 16 hours, and usually they have a long-acting levodopa pill during the night. So parts of the complication is the tube may be displaced, and um, the rare symptom will be uncomfortable around the area, or severe cases will be some obstruction or perforation or the pump failure. So the doctor will be monitored closely for people on the gel treatment. And overall, the the gel is still going through the small bowel. So sometimes people still find the protein or food can interfere some of this gel being delivered. So today I cover information for management for later stages of Parkinson's, and thank you for watching.